Hello, everybody. Welcome back to the Beat podcast, brought to you by Health. I'm so excited to be with James York today. He's the Chief Commercial Officer and Head of Government Affairs at Molecular Testing Labs. It's such a pleasure to be here with you.
Thank you so much for having me.
My pleasure, James. How's the meeting going for you?
I have a saying. It's called Home Run Derby.
Ah.
This conference has been Home Run Derby for me today. It's so exciting. So we're in a booth.
Yeah.
We're in the diagnostic zone.
Yeah.
And it's the first time ever for health to have a diagnostic zone. And I just think it's great recognition of the importance of diagnostics in healthcare.
The landscape's changing, and there's more precision medicine. There's more proactive care. I'm hearing a lot more of it. And I'm excited to dig into some of the work that you and the team at Molecular Testing Labs are up to. Just to begin with, James, tell us a little bit about the company.
Okay. We are a bootstrap company. We got into the diagnostic space about 12 to 14 years ago on the premise that everyone should have access to diagnostics and testing, no matter what the situation or circumstances of the patient, or in this case, the consumer is. We generally focused on the most stigmatized testing conditions that you can think of as our case study and our proof of concept for building the company. And so in around 2015, 2016, we started in HIV and STI testing. Wow. Since then, we've just been expanding our menu into chronic disease management and wellness indicators for testing, with the belief that healthcare has to change. There's a cliche that healthcare is broken. I don't think that it's broken. I think that in general, it's effective for how it's designed. But there's a new path for how consumers can now take care of their own health, which is why everybody is at this conference right now. I've been to many conferences this year, and one of the things that I love to hear every time is that everybody that needs to be a part of solving healthcare or be a part of the solution is in the room. And I just think health is that's never been more evident and more clear, as when you get a lot of big brands, a lot of big names that are not necessarily the incumbents in health. The incumbents are talking about disruption and transitioning and transformative things, but they're also talking about shareholder value. And those things don't compute. They're not compatible. This group of people is reimagining what healthcare can be, focused on consumer experience, like really moving the needle on where the occurrence happens and what the patient journey looks like for how to enable them. That's my answer. I just going back to the root question. I'm so excited to be here and just all of the great signals that this conference is putting out.
Yeah, for sure. It's definitely exciting and a lot of signals pointing toward a better healthcare tomorrow. What are you obsessed with specific to changing how healthcare operates?
I think right now I'm obsessed with patient journey, obsessed with enablement and activation and all of the tools that we have around that. Obsessed with reducing cost. Mm-hmm. In general, there's a lot of conversations going on around access, and access is not achievable unless it's affordable. And so we have so many tools right now to just generally think about how do you create these patient journeys where they're achievable, they're convenient, they're accessible, and everybody that engages understands what the cost and what the promise of the outcome is.
I think well said. The whole thing about if it's accessible, it's got to be affordable. That's just the bottom line, and it's not right now. And patients are paying more than ever for drugs and care, and what do we do about it?
Yeah, I heard this term recently called functionally uninsured. I wish I could take credit for making that up because it's a brilliant term. And so all the person that said it meant was the majority of people that get their health benefits through their employer has a $5,000 or $10,000 deductible. And the majority of people that are employed have less than $700 in their checking account. They are therefore functionally uninsured because if they're generally healthy, they're never going to meet their copay or deductible responsibility. And so people don't have the ability to access care because they don't understand what it's going to cost them to engage.
Yeah, I like that term, by the way. It hits the problem square in the nose.
Right on. That's why I wish I could take credit for it.
How important is it to have a pioneering culture in healthcare? And what challenges and wins have you experienced with this mindset?
It is not easy to be a pioneer in healthcare. I'll start there.
Pioneers get spears.
Oh, man. Yeah, I'll use that one too.
I'm glad I could contribute something there.
Snitches get stitches.
You guys ready for more?
Yeah. We're going to the pen now. We're in the yard. Oh boy. Okay, let's get this back on track. Okay. Pioneering. Pioneering is so hard. Just think about what we do in the diagnostic space. Okay. We believe that diagnostics should be accessible. That's disruptive to large labs. Mm-hmm. And if you just in general think about like how disruptive that is and how people need to be able to protect their business. We've had so many headwinds on a regulatory front, basically because we're pioneering. We're going into spaces that nobody's ever encountered. And I'll give you a great example of that. In 2000 and I believe it was 2015, we actually went to the FDA and we said, we're going to start at-home self-collect testing for HIV and STI testing. And they said, okay, sounds great. We're going to need to regulate that. And at the end of the day, what kind of shook out from that scenario is they didn't have a way to regulate it because we were doing something so novel and so unique. And so we, at the core, are compliant, high integrity people, and we wanted to be regulated because we wanted it to be like, get that stamp of approval that it's safe, accurate for people. And they didn't have a way to regulate that. And so we ended up going to market. We just said, this is what we're going to do. We had some advocacy from the CDC and NIH and some other agencies at that time. And we just said, look, if you ever get to a point where you want to regulate us, let us know. And so that point came in 2022 where the FDA said, okay, we now need to know what you're doing and how much of it we're doing. And when we told them what we were doing, over 5% of all the nation's HIV testing on self-collected dried blood spots. So we had gotten very large. And they said, okay, now we've got to get you into compliance. And so we've been working to do that. We put all of our resources into it as a bootstrap company. That's not much, not a lot of big PE backing and VC backing and things. And so we ended up getting to a point with the FDA where we just couldn't move fast enough. It was too costly. It was too arduous. It was just too much for a company of our size to do. And they ended up sending us a warning letter. And I regret that. Like, I hate that moment because getting a warning letter from the FDA is not something to ever be proud of. The reason I'm telling that story on a podcast is because I think it just speaks to like how hard it is to pioneer because it's very expensive, especially in healthcare. But it also, like, getting a warning letter like that says you're doing something meaningful, I guess, if there's some silver lining to it. Yeah. So we are working with the FDA still to this day to get into compliance. It became very disruptive for a lot of patients that relied on that testing. And so I just regret that those kinds of things happen in healthcare. But when you are pioneers, that is part of the territory. Like, you're going to get hit sometimes, and we got hit. So it's too bad. But what does it mean? I think the way that I look at diagnostic testing is there's a lot of different ways to innovate diagnostic testing. There's a lot of people that are focused on better sensitivity and greater accuracy and more technology and more genome sequencing and things like that that are focused on like really high level problems. Those are not the areas that I'm focused on. I'm focused on the areas that are like really routinely prescribed tests like A1Cs and colorectal cancers and kidney dysfunction and thyroid, you name it. Like, I want to focus on the areas that technology is not the innovation required. Access is the innovation required. Yeah. And so that in its own sense makes us pioneers because we started that market. We started that market in 2015. We continue to lead that market. I am proud of that. It's not been easy. Pioneering in that sense meant that I started out trying to convince people why this matters and trying to sell it to them. And like, I don't like to sell because selling means that you're providing something that either doesn't have value or you're convincing someone that they have a problem. Mm-hmm. Now, fast forward to 2025, there's all these like sentinel indicators of how people are recognizing that diagnostics are a flywheel for care. They are an activation point for patients. They can empower the strategy, especially where virtual care is being applied. And so pioneering in this sense meant change is fun, right? Yeah. Change is hard. It is. It just meant that I had to spend 12 years convincing people that they had a problem that they didn't know about. I don't have to do that anymore. There's a sense of relief at this health for me that like people are coming to my booth and saying, I know what you guys do. And I'm happy to be talking to you. And I would love to know how you could help us empower our strategy. And we're talking about big companies.
So I have a question. Love this, by the way. And so what is it that differentiates you guys? Is it access and price point? Like, talk to us about the differentiators. What makes you guys different than a standard lab?
Yeah, so I think the way that I characterize a standard lab is at a really high level, patient service centers. So I think of the reason why people weren't talking about what we do for nearly 12 years is because the large healthcare ecosystem would generally work to solve a problem And when it came to diagnostics, they would say, oh, we have Quest and LabCorp. And again, Quest and LabCorp are great companies, so we're not trying to disrupt that. But it doesn't solve the problem for everybody.
So James, tell me about how you do it and why it's different.
Yeah, so the traditional context of labs is a patient service center, which is great for some people that can make it to their doctor and get an order to go to a lab. Okay, that doesn't work for everybody. All the way back to starting with get to a doctor. Yeah, there's barriers and resistance and friction that we call it all over the healthcare ecosystem. If we can, like what makes us different is we address the barriers. Mm-hmm. So the barriers are economic, they're geographic, they're stigma, mistrust, and inconvenience. I think of those as the general 5 friction points for all of healthcare. Mm-hmm. So if any one of those reasons is a reason why somebody can't get to a patient service center for their labs, we have to address that. And so what we're doing that's so different is we make it possible for people to collect their own samples, either through a dried blood spot fingerprint sample. There's a lot of upper arm devices. There's companies like Red Drop and Tasso and Your Bio, great companies, awesome technology. They're coming to market, making it Lancetless and painless to collect a sample. There's urine collection, swab collection, you name it. If you can collect a sample at home and essentially validate it and correlate the results of that to the gold standard of a venipuncture blood draw and say that you have an equivalent inaccuracy with some kind of allowable error rate, right? Then you can make a test that addresses all those friction points for the patient. So like at the end of the day, it's really not that different. We're taking the same test that a large lab is using for their test. It's generally 510K cleared by the FDA. We're modifying it to use on a different matrix like dried blood instead of wet blood. Mm-hmm. And so the beauty of those types of programs is you can put it in your mailbox, collect your sample, stick it in the mailbox. I've just cured the friction point of geography. Mm-hmm. I give somebody a fee transparent access point where I know it's going to cost me $30 to do that test. And I'm willing to say, yes, I'm willing to spend $30. I've now cured some of the economic friction because I've made a decision that I'm willing to pay for it, and it's a part of my care journey. Most of the testing that we support is through virtual care or digital health campaigns. And so now I've cured the stigma, the mistrust, the friction of inconvenience because I've made it convenient for them and discreet so that they can get a result that they need. And so at the end of the day, here's a big math problem that sucks for healthcare is 70% of all decisions in clinic are made off of a lab, and yet 7% of the total spend of healthcare is on labs right now. You can easily see the problem. Yeah. And it says that there's a massive amount of fallout that occurs in the traditional sense where someone gets a prescription and doesn't make it to the lab. You cannot continue that care journey. If somebody is accessing their care virtually, where since COVID, more and more people have started to access their care virtually. I think I've seen rates of 14 to 17% of all patient encounters are happening through virtual care platforms. It's not logical to think that whatever was the reason why that patient encountered their care virtually, that they're willing to go physically to a lab. So we have to be able to address that. And so like, that's a really long-winded answer to your question of like, what do we do that's different? We're addressing the friction points. We're enabling patients to be life-centric instead of system-centric.
That's great. Yeah, no, I appreciate that. It's making it easier to collect and deliver convenience in your own home. It's removing the friction on the cost for access and ultimately just making it easy. Make it easy for me, man. Make it easy for me. By the way, people are willing to pay a premium for this. Like I recently needed to go do my blood work for the routine annual.
Okay.
I paid an extra $99 for a blood company to come to my house.
Okay. For convenience.
For convenience. I don't want to go into the lab.
Yeah, imagine that.
So, you're talking my language here, man.
I hope so.
Yeah.
And in our case,
many people's language.
In our case, we're not charging a premium for the testing that we do. I cannot express like how important it is that access requires affordability. And so we think of ourselves as being an enabler. We don't price anything that we do at a premium because then it therefore takes it out of the market. And so everything we do is based off of simple mathematics of what does it cost us to run? What do we need to run our business? And that's how we price it. And so there is nothing in our test menu that is priced at a premium.
There you have it, folks. There is a way to do diagnostics different than you have ever done them. And it is molecular testing labs James, this has been great. I've really enjoyed our conversation. If people want to learn more, how can they get in touch with you and how can they learn more about the company?
Obviously, go to moleculartestinglabs.com. Everything is on our website that speaks to what we do and how we do it. We are a B2B focused company that enables other people's strategy. So the reason you haven't heard about our name is because we don't put anything in the market in our name. We power our channel partners' strategy to help them activate their own patients. I'm on LinkedIn. We have a booth here at Health. If you're at Health, please come by and see me. I would love to talk about how we can power your business.
Love that. Well, thank you for that invitation, James. Folks, take James up on the invitation to lower costs, improve convenience, make testing more accessible. Now is the time. Now is the opportunity to do that with Molecular Testing Labs. James York here with me, Chief Commercial Officer and Head of Government Affairs on the Beat podcast. Thank you guys for tuning in. Check out the show notes for all the ways to get in touch with him. And James, thanks for spending time with me.
Thanks for letting me play in the pros.
It's such a pleasure to have you with us.
I appreciate that.